feel like we should move on.
Yeah, I got it.
Normally I can make a whole room go quiet with 5 words. Is that on the record? So look. Good morning and welcome to Wednesday Morning Roundtable. I'm Rob Forsey. I'm your moderator for today. I don't have the roving voice of Guy Costantino, so you'll have to excuse me this morning, but I'm going to do my best. This morning we're gathered to talk about quite a few different subjects. But before we get started, I would like to take a second with all of you and congratulate the county and Andrew in bringing in $500 million. We all have a project we'd like you to fund. That'd be fine. You can turn your applications into him. And by the way, just for the record, letters to the editor do not make sure that you get funding. So, it is that time of the year that we all look forward to, and at the same time dread a little bit. I'm not talking about Christmas. I'm talking about all of the nonprofit Christmas parties we go to. So, if you, half of you are going to be on board with me today because I call this my busiest Wednesday of the month. So we'll be seeing each other throughout the day. But I'm going to start today talking about child welfare, maternal and child welfare here in Cayuga County. We have a panel today that we're going to get together and I'll be introducing in a few minutes. They're all going to have a few minutes to speak and talk about their programs, and then we're going to have questions at the end, hopefully wrapping up and getting you out of here by 9 o'clock. But before we start that, this is the one meeting out of the year that I'd like to be involved with. For those of you who are on board with me, you know that childhood development and child welfare is a big part of what I like to devote my time to. So one of the things that I do for that is warm the children. Usually I try to come and make a small report about what's going on and ask you all to pull out your checkbooks and leave a check at the door when you leave today. If you haven't already. Quite a few of you have, and I would really appreciate it. In the past year, we have changed our Warm the Children program. And if you're not familiar with it, in its simplest forms, we buy coats for kids who need them. Brand new coats, hand them over to them. We don't have any administrative costs between myself, Rotary, and Cayuga County Community Action Agency. We manage the program in this very room and the room beside it, because we opened up the walls. We distributed coats at the end of October, and we had over 950 children apply for the program this year. That's an increase over the prior year where we had 600. So it's one of the things you might say, well, did the need go up that much? You know, Jeff can tell you how the need is in the schools because he sees it day in and day out. But quite frankly, we haven't finished that need yet. There are still kids out there who need our help. We opened it up this year from 0. Literally, we had somebody who came in and bought a coat for came in and picked up a coat for a baby that had not been born yet, all the way to 14 years old. We opened it up to this year. And so I'm in the world of buying adult-sized jackets along with children's-sized jackets now, which is completely different and also incredibly expensive, which is where you come hopefully later. We are looking to make sure that we're continuing to service this need as we go forward. And I can't do it without your help and without the help of the people in the community. And I have to say that in the 3 years that I've done this now, it has been incredibly satisfying and also incredibly successful. We started the first year helping out 80 families. Later that year, I said that's not enough. We helped out 400. And then last year, we did initial 400. Then this last year, we did 600. This year, 950 people applied. And we were able to we're going to talk a little bit about today, like I said, maternal and childhood development here in Cayuga County. And that's just one aspect of it. I don't think that there's a place in this room that I haven't seen it involved in some of these efforts. So I really appreciate that. We're going to start with Deanna She has an MS in Senior Public Health Educator and has been with the Cayuga County Health Department for the past 8 years. She will discuss Cayuga County data and statistics for childhood overweight and obesity and what the Cayuga County Health Department has been working on to improve the health of children in our county. Elaine Daly is a graduate of Niagara University with a BS in nursing. She works at East Hill Family Medical as their school-based dental program manager. Prior, she served as Director of Health and Human Services and County Public Health Director for 36 years. She serves on a number of local boards, including Auburn Community Hospital, Unity House, Compton Community Health Network, and Lifetime Care. Elaine will discuss East Hill's recent expansion of school-based dental services in partnership with Cayuga County WIC program. Beth Hooper is the Cayuga County WIC program coordinator. She is a BS in dietetics from SUNY College in Buffalo, coordinating the program and over 15 years of experience with the NYS WIC program. She has worked in Erie, Broome, and Tompkins County before coming to Cayuga County in April of this year. She'll be presenting on the history and mission of the WIC program to help increase understanding and awareness of how the important program helps women, infants, and children in Cayuga County. So we're going to start with Elaine Daly. So if you can help welcome Elaine to the podium.
Thank you very much. I do know a lot of people in this room, so hello to all of you. And those I don't know, I'm glad to be here today. It is true, I did work for the county for at least 36 years, and I was retired for about 5 months before I took this job at East Hill Family Medical. I can tell you it was because I had such concern about children's oral health issues, and that's partly true. But when I got the offer for East Hill, it was a part-time job, flexible hours, and no summer. So that really helped as well. Anyone who knows my husband, he'll tell you, he goes around town, he's retired too, that he pays half of my salary just to get me out of the house. So I'm not allowed to have all that long. But I am here today to discuss the issues that affect, children's issues that affect our community. And I'm here to talk about children's oral health. Oral health has taken center stage from a state perspective, along with a lot of other health initiatives. The state's preventive agenda, 2013 to 17, includes the New York State Health Plan, which was developed to guide state and local action to reduce health disparities and improve the health of all New Yorkers. It identified the prevention of dental caries, which is cavities, as a top public health priority. In 2014, the New York Oral Health Plan identified the need to reduce emergency room visits and visits to ambulatory care centers for the treatment of early childhood caries. Dental caries or cavities is the most common form of chronic disease in children, despite it being a preventable disease. Statewide, 23% of 2 to 5-year-olds have caries experience and 10% have untreated decay. The rate of children being treated in the ER and the ambulatory care centers for this has risen steadily since 2005. There is an emphasis on both care providers and caregivers in determining and addressing the risk factors for dental caries. There is a biological, social, and behavioral component to this disease. Cayuga County has long known for a period of time that the county has significant oral health issues, evidenced by a number of initiatives that have been undertaken. Up until 2011, County Health Department was the recipient of a small Department of Health school-based preventive dentistry grant. Under this grant, the county screened kids in kindergarten, and they applied sealants to 2nd and 3rd grade students. The statistics were collected every year on the rate of dental caries and tooth decay. Parents were notified of the findings of these screenings, and oftentimes for a host of reasons, follow-up care was never coordinated. Year after year, the county would go back to those schools and see the same issues. The county served all the schools when they had the program in the city and in the county. Taken from the Health Department's 2011-12 Community Health Assessment, Cayuga County had an abnormally high rate of dental decay. 3rd graders with untreated caries was twice that of the state, with the exception of New York City. Our use of ER and ambulatory centers for 3 to 5-year-olds grew by 300%. The Brush to Crush Cavities initiative that started a number of years ago, and actually I think started it from Deanna's master's program. She began Brush to Crush at the health department, and this brought services to Genesee and Casey Elementary, which are two high-need schools in Auburn. There was dental screenings that were provided, there were oral health education that was given, and there was actual brushing in the school. It was in existence for a number of years, and I think still is now. The most recent 2014-15 Brush to Crush Cavities initiative continued to support that there was still a significant number of children in the schools with untreated dental caries. At Casey last year, 344 children were screened by a dental hygienist from East Hill. 44 had potential decay, 9 were in need of immediate care. At Genesee, 102 children were screened. Over 25% had oral health concerns, and 17% were in need of immediate care. There's a huge discrepancy between 344 and 102, and that's basically because the state said you cannot screen a child's mouth without parental consent. So when we were at Casey, we did 344 kids with tacit permission, but we then instituted parental consent for this free dental screening. So it did drop our numbers a little. When the county turned the preventive dentistry grant over to East Hill in 2011, the hope was that the limited services that were being provided at the school could somehow be expanded. East Hill has and continues to have a full-service dental on their operating certificate, and the state made a rule that only one Article 28 could be in the school at a time. So at that point, East Hill was in a better position to expand than the county, and it certainly appeared that there was need to do so. East Hill took the sealant grant over in 2011. They are and still are currently serving for these targeted sealants: Casey, Seward, Genesee, Cato, Southern Cayuga, and Fort Byron. But over a year and a half ago, the Auburn School District, working with the Partnership for Results, received a grant from the State Education Department, a 3-year community schools grant. 5 schools were chosen by the state as community hubs to receive a number of services, and one of those were full-service dental. East Hill agreed to be part of this, and the grant went ahead and paid for startup costs and administrative support to allow East Hill to expand their program. The school has long recognized that oral health is tied to overall health and school readiness, and it appeared that the funders did as well. Through this community schools grant, we have a mobile dental clinic going into Auburn High, Junior High, Seward, Genesee, and Herman. We are at the schools doing far more than screenings and sealants. We are now able to provide comprehensive exams, cleanings, fluoride, x-ray, and fillings. As a school-based health center dental, we are required to bill insurance if it is available, but are also required to offer preventive care at no cost to families who are uninsured. We are one of the few full-service programs that are in existence. Most clinics or most programs that have dental in the school, it's just preventive care. Since full-service dental is not an inexpensive proposition, and to help further support the program and sustain it, East Hill applied for and was awarded a federal expansion services grant in September. This will help support the expansion of services in their dental office and in their school. We will be adding Fort Byron and Casey to our full-service schools, as well as some of the off-site Head Start classrooms. This grant will support a much-needed hiring of an additional dentist to support the work. The hope is to build the program to a sufficient enough level that it can be sustained through insurance billing once these grant funds end. Providing school-based services is about improving access to care, making it easier for services to be provided, and having less children lost to follow-up. Getting children before their situation is so involved that a specialist referral is needed is one of the primary goals. These school-based services is one strategy to try to address this problem. Prevention of dental caries is still the primary focus. The earlier we start, the better. Early childhood caries is defined as one or more areas of decay or missing teeth in a child under the age of 5. There was a recent recommendation made by the United States Preventive Services Task Force to integrate oral health into primary care practices. Often children don't see a dentist until there's a problem. 23% of children in poverty don't see a dentist till the age of 5. Primary care providers see children in their office an average of 13 times the first 36 months of life. The recommendation is being made so that we can integrate oral health education into the medical visit. Parents need to understand the disease and how to stop it. For dental caries, you need teeth, bacteria, carbohydrates, and time. In the medical home, they can discuss toothbrushing, nutrition, oral hygiene habits. They can make referrals to a dental home. And the big recommendation coming from this is the application of fluoride varnish to children's teeth 2 to 4 times a year, from the time the first tooth erupts until the child is regularly seeing the dentist. With this fluoride application, which is actually painted on the teeth, comes the oral exam and the risk assessment by the medical home. Although the recommendation has been made and the varnish application is reimbursable by Medicaid and third-party insurance, it will take a while before this takes hold in the medical office. As varnish is one of the strategies for early caries, East Hill has recently begun a pilot program working with the health department and the WIC program to begin a monthly WIC Smiles program at the Cayuga Clinic. At the clinic, we are offering varnish to WIC-eligible children with parental consent, and our plan is to varnish these kids every 3 months till they start seeing the dentist on a regular basis. We have had early discussions about varnishing early Head Start children as well. Dr. Clark from Albany Medical Center, the champion of this initiative, said 80% of children, 80% of cavities are in 20% of children. And these are clearly the children we are hoping to reach. Engaging those children and families with the highest need is not such an easy proposition. This 2015 school year, we have so far gone to Cato, done the screening in the 2nd and 3rd grade Salins. We went to Casey, where we screened 210 children, K through 6, served 56 children with 106 visits. We also served 8 Head Start children at that school as well. We just started at Auburn High and screened 81 children and sent out 69 enrollments for applications to enroll in school-based services. At the high school, 48 children have potential decay of those 81, and 13 had immediate need. The challenge is to get those enrollments back, and that's where our work with the school district is essential. So there's no one strategy or solution to address these issues around oral health. But with this start and our sustained partnerships, I feel the community, as a community, we are certainly in a better place than we were. Thank you.
But just our official name is the Special Supplemental Nutrition Program for Women, Infants, and Children. We are a grant program. We are not a mandated program. So our funding comes through the United States Department of Agriculture, and the money goes straight to New York State Department of Health in New York State, and then the Department of Health distributes it to 93 local agencies throughout the state. What the video is going to tell you is half of the infants and about a quarter of the children in the United States receive WIC services. In New York State specifically, that translates to about 500,000 women, infants, and children that receive our services. Locally, here in Cayuga County, about 1,500 women, infants, and children receive our services. So it's important. And what our mission is we really want to improve the nutrition well as whole grain breads, fresh fruits and vegetables, rice and pasta. We also provide participant-centered nutrition education. What we want to do is meet the participants where they're at, see what they see as the issues within their own household, and help enhance and answer their questions. We also are a big source of healthcare referrals. So we work with closely, we run by the health department, sponsored by the health department, but we provide referrals to immunization clinic, lab clinic, Head Start programs, Nurse Family Partnership, a lot of human service agencies as well. And so in addition to the healthcare referrals, the last thing we really want to focus on is breastfeeding and how important breastfeeding is in giving your infant the best start. And in doing so, we have a peer counseling program that helps our moms. Whatever it is that their goals are, we really try and help establish and support them whenever way possible. So I'm going to ask Lisa now to help me. And basically the short video, like I mentioned, just talks a little bit about the history of WIC, what drove the creation of the program, who the players were that wrote legislation, and how they really got passed through Congress. It also gives you a little insight into what we do every day.
The Special Supplemental Nutrition Program for Women, Infants, and Children, or WIC for short, has become such a basic part of our nation's nutritional safety net that many people can hardly imagine a time when the program did not exist. From a tiny program serving 88,000 participants in 1974, WIC now reaches more than 8 million people, including nearly half of America's infants and a quarter of the children aged 1 to 5.
WIC provides specific foods that provide nutrients that have been identified as missing and as essential for good health outcomes during pregnancy and infancy. And it was designed to address the major hunger and nutritional deficiencies that were observed in our country in the mid to late 60s.
The 1960s was a time of great ferment and unrest in America. A time when many believed societal wrongs could be righted and problems resolved. It was in this climate that civil rights and anti-poverty groups brought America face to face with a problem it had long been ignoring. The fact that many people, including many children, went to bed hungry. Hunger came into the national spotlight in the spring of 1967 when Marion Wright, a young attorney for the National Association for the Advancement of Colored People, led Senate Poverty Subcommittee members Robert F. Kennedy and Joe Clark on a tour of the Mississippi Delta. The visit uncovered unthinkable poverty and malnutrition. More investigations and reports followed. Then, in May 1968 came the explosive CBS documentary, Hunger in America, hosted by Charles Kuralt.
America is the richest country in the world, in fact, the richest country in history. We spend a colossal amount of money, $1.5 billion a year, to feed the rest of the world. But this spring, a private agency, the Citizens Board of Inquiry, consisting of distinguished leaders in many fields, released an exhaustive report claiming that serious hunger exists many places in the United States.
The documentary revealed that hunger's victims were often children.
Do you have any food in the house now?
No, sir, I haven't got anything.
What do you tell your children when they come home and there is no food?
That we haven't got anything to eat, and we just have to lay down like that until the next day, see if we can find something to eat.
That's it?
Yes, sir.
If this was news to many Americans, it wasn't to doctors working in public health clinics. David Page, a young Johns Hopkins University pediatrician, had seen the effects of malnutrition firsthand in inner-city Baltimore clinics.
I saw a very high level of iron deficiency anemia, undergrowth, many of the infants showing poor weight and length indices. It was rather a prominent problem at that point in time. We found this to be a problem among the poor, basically. It really didn't make a difference whether one was African American, white, Hispanic. It was really a problem of poverty.
Dr. Page wasn't alone in his concerns. Medical researchers around the country were warning that poor nutrition could have devastating effects on children's minds and bodies.
There are some indications that iron-deficient children have poor attention span and perhaps learn less well. There are some animal studies which indicate that iron deficiency early in the growth of the animal can lead to long-standing changes in the brain.
But if the problem lay in poor nutrition, could it not be remedied by improving the infant's diet? That was the idea behind a small experimental program that Dr. Page launched in Baltimore in 1969. A program that was to become one of the models for WIC.
It struck me that it was a rather logical approach that we provide food as in the same way that we would provide medication. We used medication to treat pneumonia or other diseases. We could use food in a therapeutic sense to begin to ameliorate a range of nutrition-based health issues.
Page approached the Maryland Food Committee, a nonprofit organization that worked on hunger issues, seeking a modest grant to test his idea.
Dr. Page presented what he wanted to do and what he hoped to accomplish, which would be better nutrition for their babies and better school readiness for the children as they grew. And I felt that he was worth supporting in this particular project.
Page sought to offer iron-fortified infant formula to high-risk, low-income mothers at a clinic in Baltimore's Cherry Hill neighborhood. After tracking the infants for about a year, Page began to see striking improvements in the children's health.
We began to see a marked reduction in the level of growth stunting as well as iron deficiency anemia. We were quite excited by that.
Anxious to see if he could achieve similar results with a larger study population, Page began to work with the Maryland Food Committee and state and local health departments to expand the program to other areas in Baltimore and across the state. The group received a federal grant to help with the effort, which they named the Iron Fortified Infant Formula Program. Mothers had been picking up the canned formula at clinics, but as the program grew, Page and the committee realized they needed a more efficient distribution system.
We came up with a system that really approximated a traveler's check so that we could provide to the mother in the clinic a voucher. She could sign it and then countersign it when she redeemed it at the store.
At the same time that the Maryland infant feeding program was expanding, pressure was mounting at the federal level to find a way to address the problem of malnourished women and children across the U.S. In 1968, the Department of Health, Education, and Welfare had convened a series of meetings to seek ways to address the hunger-related illnesses doctors were seeing in local public health clinics. Among those invited to attend was Rodney Leonard, who oversaw food assistance and safety programs within the U.S. Department of Agriculture.
Essentially what they needed was to be able to prescribe food for the clients who were not ill and needed a drug. They needed food. So in order to meet that request, we developed a system of commissaries that the Department of Agriculture stocked. It was a USDA budget that would use to provide a service that HEW could not provide out of their own budget stream. And so we built the commissary in the local clinic, stocked them with food that the doctors said that a mother and an infant would need, including infant formula.
Lack of administration support kept the commissary program from reaching large numbers of people. But after Leonard left the USDA to found the nonprofit Community Nutrition Institute, he began to brainstorm a more far-reaching effort with Jim Thornton, an aide to Senator Hubert H. Humphrey. The two men came up with an idea for a new federal pilot program that would become the Special Supplemental Food Program for Women, Infants, and Children. In designing their program, the men drew on the Johns Hopkins model, as well as an infant feeding program at St. Jude Children's Research Hospital in Memphis, Tennessee. WIC would provide vouchers for nutritious foods to women, infants, and children who were considered at nutritional risk. The program, which was to last for just 2 years, was also to include a scientific evaluation of the impact of the improved diet on the health of mothers and their children. Although the $20 million a year initiative was modest by federal standards, Thornton and Leonard anticipated resistance from the Republican Nixon administration, which had been impounding funds for social programs enacted by the Democratic Congress.
We had every reason to believe that the incumbent administration would oppose it, would not support the appropriations for it, so we had to figure out a way around it.
Thornton and Leonard wrote language into the WIC legislation that required the administration to implement the program.
The word "shall" was used everywhere in the law. There was no permissiveness. The Secretary and the President had no choice, and the Congress passed this. They were under obligation, legal obligation, to carry out the Congress's wishes.
And instead of funding the program through the normal appropriations process, they tapped a little-known pot of Agriculture Department money to provide a guaranteed funding stream. But perhaps the greatest coup was to enlist Minnesota Senator Hubert H. Humphrey as the chief sponsor to usher the legislation through the Senate.
He was a man of great influence and great power at that point in the United States Senate. And when we went to him with this program, I can assure you it took no convincing whatsoever.
Thank you. I think what I like the most about this is when we have our inception due to a pediatrician out of Baltimore, Maryland, who saw a need and came up with an idea and a way to solve a problem. Simple. Food is medicine. And that was the model for what became the WIC program. So, and we're still going strong today. Just in efforts of time. Just who qualifies for the program. So pregnant women, infants, children, the program goes to age 5. We have a brand new website called WIC Strong. Cayuga County is one of 13 counties in central New York that is part of this WIC Strong campaign. Women can now apply online. We also certainly welcome fathers and grandparents who have custody of their children to call and contact the program as the benefits are for the children. And one last thing I just want to point out is that our income guidelines are very generous. We do have guidelines, but they're set at 185% above the poverty level. A lot of people do not know that. They think that you have to meet income guidelines for Medicaid or food stamps to be eligible. It's not true. So you basically, in real terms, you can make up to $45,000 or more a year for a family of 4 to qualify for a program. And where you come in is if you see a 2-income household. A lot of times we get a phone call from a pregnant mom who's working, dad's working, but she wants to stay home. So they may not qualify when she's pregnant, but they may qualify after. So I encourage you, I have some pamphlets up here, and if you want any further information, I can give you my contact information. So thank you. Thank you, Ron.
I was joking with Elaine that I wore heels today so you could see me past the podium. So I'm Deanna Hoy. I'm a public health educator with the Cayuga County Health Department. I've been with the department for 8 years. I started as an intern and then got hired after college. So I value internships and tell people to intern all the time. So basically, I'll give you a little bit of background about the health department and how we receive funding and how it kind of dictates the work that we do in the community. So we apply for competitive grants, which means we compete with other agencies to seek funding when we identify a problem. We also get regular funding that's non-competitive for different programs, and then we also have state aid, which allows us to do some of the work that we don't have grant funding for. So along with state aid, the New York State Department of Health requires that all health departments in New York State complete a community health assessment every 5 years. And so based on our findings, we work with a consultant and we identify areas of improvement that we've made, which is always great to see. And then we have identified areas of concern and then areas where we really should focus our time. And so now the state requires you to do a community health improvement plan. And that plan lasts for 5 years. So you identify your problems, You work on designing activities and programs that will address those problems and hopefully improve those problems over the course of 5 years. And so sometimes we're not the lead agency on these activities or programs. Sometimes we're facilitating or engaging other community partners to work on these projects. Like we gave up our school-based dental grant because we saw the value in East still having the dentist and the dental hygienist in the clinic. So things like that really kind of demonstrate the work that we do. Sometimes we're not the lead agency, but we identify the problem and work to address it. So our community health improvement plan required that we worked with Auburn Community Hospital on 2 objectives. So a lot of that is related to maternal child health, so increasing breastfeeding rates and reducing preterm birth weights. So I'm here today to talk to you more so about the preventing chronic disease focus area of our community health improvement plan, and specifically related to childhood obesity rates in Cayuga County. So when we talk about reducing childhood obesity, we really kind of have to understand the statistics. And so we designed our community health assessment. What we found was that Cayuga County children and adolescents who were obese was 21.7%. And that exceeded the New York State percentage at the time of 17.6%, and the goal for the state in 2017 to be at 16.7%. So that put Cayuga County at the 2nd highest in the state, behind New York City, or excluding New York City. One other thing that the schools are doing to help give us this information is that now on the school physical, medical providers are supposed to do student weight status. And what that is it's BMI. So it's not a great indicator, but it's the best tool that we have right now. So it's height, weight, gender, and age. And then the students are categorized into 4 different categories. So underweight, healthy weight, overweight, or obese. And one of the reports that we looked at when we designed the improvement plan was the 2008-2010 report. And so when the doctor gives that information to the school nurse sends that on to the state. And so the schools in Cayuga County that participated within the 2008-2010 time frame, we found that 35.9% of Cayuga County students were categorized as being overweight or obese. And then we knew 1/3 of New York State's children were categorized as overweight or obese, so that's 33%. But when we looked at ourselves compared to other counties, we were 3rd highest in the state. So only behind Oswego and Sullivan counties. And so we've designed a lot of our programs to work with the schools. We've participated on many school district wellness committees so that we can target physical activity and nutrition-related policies. One of the greatest successes that we saw was promoting the use of healthy fundraisers. And so school walkathons are becoming very popular in Cayuga County. Owasco School has been able to fund a lot of their PTO-funded related activities just by doing the one fundraiser a year. As well as A.J. Smith Elementary in Union Springs School District. So we've been working on trying to get kids out there walking, doing different things. We've been doing presentations in the schools about nutrition and physical activity, getting the kids to realize that they don't have to necessarily be the ones buying the groceries, but they can make the choice at the cafeteria and the school lunch line. They can make a choice when they go to the movie theater with their friends or the concession stand at a football game. So they make choices even though they're not necessarily bringing the groceries in. So we want kids to realize that they have the opportunity to make better choices. So for over 20 years, we've had chronic disease-related funding. And I won't bore you with all the different programs that we've had, but one of the most recent grants that we had was called Creating Healthy Places to Live, Work, and Play. And that focused on not necessarily going out to health fairs and telling you to eat healthy and you to exercise more. It really focused on environmental, system, and policy changes. And so I'll use one example as how we were really able to see a change. So we tested the crosswalk in front of Mesa Grande with just having it painted the normal white lines with the checks going across. And we counted how many cars stopped for pedestrians in the crosswalk. And then we partnered with the city of Auburn to ask them to station a police officer in a marked patrol car at there, and we counted how many cars stopped. And then we put a sign up, and we counted how many people stopped for the pedestrians. And then we asked the city to we bought the paint, and we asked them to paint that crosswalk red. And the red crosswalk was so much more effective in getting motorists to stop for the pedestrian than having a marked police officer there or the signage. And so we expanded those crosswalks in the downtown area, and then most recently we expanded to the school zone crosswalks. So we partnered with the Auburn School District and the City of Auburn to get those crosswalks painted so that more kids will feel safe walking to school, and that the motorist acknowledges the pedestrians so that it creates an environment where pedestrians feel safe. So that was something small. It started with one little crosswalk, and we saw a tremendous impact, and we hope that that work expands. Some other work that we've done through Creating Healthy Places was we wanted to create access and opportunities. So we worked with a bunch of different communities to improve the trails or enhance the trails. So like the college trail, the nature trail, we provided some funding for signage and bicycle racks, and in the village of Cayuga and in Cato, we provided fitness stations that were placed along the trails. So we want free opportunities for people to be active, and then snowshoes. We provided the college with snowshoes and Cato Rec Center with snowshoes so that the trails can be utilized year-round to promote physical activity. So in relation to policy work around obesity, we've done some work with the City of Auburn, the Town of Brutus, the Town of Montezuma, and the Village of Weedsport to pass Complete Streets policies. And Complete Streets policies really incorporate all users of the roadway. So whether it's a person with a disability, with a walker or wheelchair, or someone who's visually impaired, whether it's a mother pushing a stroller, a person walking or biking, it incorporates everyone in the design elements. So when a municipality takes 1 penny of federal money, they are required to do complete street work. So making sure that all people are incorporated into the new design of the roadway. And so the City of Auburn, the Town of Brutus, the Town of Montezuma, and the Village of Weedsport have passed their own policies so that all of the new work that will be done on the roadways in our communities will incorporate complete streets design. So that's a great thing, because even though it's a federal mandate, the New York State Department of Transportation doesn't, they see it as a recommendation, they don't always enforce it. And then we promoted nutrition. So we promoted community gardens. One of the greatest successes that we saw was instituting a community garden at Malone Village at the Housing Authority. And it expanded tremendously over the past few years. And the residents of Malone Village, they maintain it. They take pride in it. They share their produce. And we're creating opportunities for them to try new fruits and vegetables and have the accessibility of it right out their front door. And then we worked on a restaurant initiative called Dine Out with Healthy Choices, where we tried to get restaurants to offer healthier items to their consumers and their clients. And so we had 14 restaurants that participated with us. And so as much as I'm happy to promote the work that we've done, unfortunately the grant funding did end in September of 2015, and we are actively seeking new chronic disease funding. But the good part is that with our improvement plan, we have state aid money that we can still do some work. So I think I touched upon everything that I wanted to speak to today. There's plenty more work that we do, and if anyone has questions, feel free to ask me, but I won't keep you too much longer. Thank you.
So if you can come up with healthy poutine in Prison City, I would really apparently that's not on my diet. Before we get started on the questions from the audience, Beth, really quick on the WIC program, what are the age qualifications for children?
Up to age 5, up to school age, yeah.
Great. Does anybody have any questions? Scott?
So can we talk about fluoride for a second? You mentioned varnishing. Cayuga County, you mentioned Cayuga County's rates are high. You don't fluoride our water in any of our communities. Where do we stand in comparison to other upstate areas when it comes to fluoride? And that's a cyclical issue, so you think it'll come back on?
You know, when we participated in some work in Cortland County, they were facing the same issues in terms of having no fluoride in the water. The county does. I know there, when I brought this up at the dental advisory that I sit on the time that Dr. Hoffman came, I said, you know, this really, that obviously is one of the strategies in the prevention of early childhood caries. And I said, you know, how about you champion that again? He goes, oh my God, Elaine, they called me a communist when I got here. I mean, it was a very heated area when this came up. But I think from what I heard from the health department is there is some monies coming through from the state to help municipalities offset the cost of putting fluoride in their water treatment if they're so interested. And I know I'm aware that there is a referendum that has to happen to get fluoride in the water here, but last I talked with Deanna, there was some talk that the health department would be approaching the city of Auburn. Is that sort of?
So right now, we are doing some research and getting all of the data together for a presentation to our local board of health, because this is a topic area that they are very vested and interested in. And so based on the presentation and the findings, then that will kind of help guide us to what our next step is. So our first step is to really approach the board of health with the information that they've been asking for to fluoride. And we are comparing our dental carry rates versus other communities that have fluoride. So Onondaga County and Wayne County, we've been comparing our data. We're trying to compare school-based data with the communities that do have fluoride.
Would you hope that they'll make a recommendation? I mean, the board of health would get behind somehow.
I think we're trying to start there is to educate the board of health, and then if they decide to make that recommendation, and then we would pursue it further. I think it's been about 10 to 15 years since it was last brought up.
It is the big elephant in the room. I mean, Eric, that is true.
In regards to dental, is there any current programming or plans for programming to help educate parents of these children of the importance of assisting their children with brushing their teeth? Or
And I think that was the whole intent of the recommendation being made through the United States Preventive Service Task Force. And my understanding is when they make a recommendation, it's an A-level recommendation, which means that brought reimbursement to the varnish that's going to be applied or being recommended to be applied in the medical home for just that purpose. That when the varnish is applied, an oral health exam has to happen, very, very cursory, in addition to the varnish, so that there's an opportunity for the medical home to look at the mouth and see if there's urgent need for referral. But also in those, if that is brought into the medical home, in those visits where that young child and family are there 13 times in 36 months, that's where the hope is the education to those parents takes a higher forefront. Now, we worked on a survey, Deanna and I worked on a survey that, I'm not sure if it's out yet or not, that we were going to survey the medical homes for the physicians in this community that serve these young children, and just get a sense of what are you doing around oral health? What literature do you have? How do you approach it? Do you do it, from 0 to 1 year? What do you say? From 1 year to 3 years? What do you say? And are you looking at any resources that the health department could bring to bear to assist in the education of this? Because it is really the provider and the caregiver have to work together to try to combat this. So, I mean, putting this in the medical home and having it take a higher priority, I think is one of the big strategies. I don't know if we've ever done any community-wide, you've done it in the schools, but at that point, these are school-age children, and these habits need to start earlier.
And we've explored the option of a social media campaign targeting young families to educate them on oral health habits and why you should start them young with your child. We just haven't really implemented that yet, but that's still kind of on our to-do list, is to really kind of seek some funding for that and then really start hammering that on social media and really targeting our Cayuga County parents.
Now, Portland started what was it called, community strategies against early childhood caries. So they're going to be institutionalizing a lot of those recommendations, one being fluoride in the water, one being parent education around not sharing anything with your child in terms of contaminating their mouth from yours, because it is bacteria-based. So there are a number of strategies. We haven't decided if Cayuga County will be involved in that yet, but there is work going around the state.
I drew the connection between Beth's presentation and Deanna. On the one hand, we hear that WIC is a spin out of poverty and the inability of families to afford food. And then from Deanna, we hear that 21% of our youth are obese, which leads me to conclude that for those who can afford food, the food that they're buying is not the most nutritional food and is adding to this obesity problem in our population. And I think we've all heard that good, nutritious food is more expensive than the fast food that is probably a key culprit in adding to the obesity problem in America. So what do we do about that?
So I do have a little bit of data, and Beth can correct me if I'm wrong, but there is, and I forgot to mention this, our health assessment is on our homepage as well as our improvement plan of our website. So it's cayugacounty.us/health. If anyone wants to view, all of the different data that we've collected. But WIC was kind of the model, at least nationally, I think, for what's been going on with the school reimbursement lunch program, the free and reduced lunch program. So when they did a study from 2001 to 2010, when they changed the packaging of the foods and offering more nutritious foods, Cayuga County saw that there was a decrease from 19.1% to 12.8% of children that were enrolled that were categorized as being obese. So by changing the meal program with WIC, I think that really leveraged the federal government to do the Healthy Hunger-Free Kids Act, which, a lot of mumbling and grumbling about what's offered in the schools now. Kids feel hungry all the time because of the different foods that are being offered. You might have seen that in the news. There's kids creating videos on YouTube saying, we're still hungry after lunch. But they're trying that way to really engage kids, because a lot of kids get their meals from school. They get their breakfast and their lunch, so we need to make sure that they're nutritious. So what WIC did kind of leverage that for the schools.
Well, I mean, too, and where we see a drop-off in enrollment is from infancy to when the child turns 4. So from 1 to 5, we really want to focus on retaining those children, so we know that they are getting not just the healthy foods through it, but also we're working on childhood obesity. We have a healthy lifestyle initiative. We have a lot of things that we're doing internally within the program to help increase physical activity, educate parents on the importance of choosing the right foods, like Deanna talks about. So we really, if we can focus on retaining those 1 to 5-year-olds and having parents understand the value of continuing to come into it, continuing to receive those foods, I think it'll go a longer way. And even though Cayuga County specifically, childhood obesity is high, in the state, in New York State, our childhood obesity has gone down since our food package changed back in 2009, when we started offering more whole grain options and we started offering fresh fruits and vegetables every month. So we are making progress. It's just here in Cayuga County, we want to do just a little bit better.
David?
I wonder if in the numbers you're looking at, if there's any correlation. I can't understand why Cayuga County would be doing so badly on some of these things. I wonder if there's any other demographic correlation that you're spotting that might have something to do with the fact that we do so badly. I just wanted to say one other thing. Dr. Henry Romano, this legendary, died about 3 or 4 years ago, this legendary pediatrician, spent much of his life fighting for fluoridating schools, and I'm just hoping it's fluoridating water, and I do hope you're aware of a lot of the research he's done. I remember hearing him once talk to him, and it's just a very powerful thing. I hate to lose the memory of a man who probably birthed half the babies in Cayuga County much of the year.
If I can make a comment in a response, because I do work for the WIC program as well, and we have started a different strategy of assessing before educating, finding out where the individuals are. So it's a one-on-one approach. And we're finding that as we are building on this, we are finding that our families are more empowered, and they know and they are taking the action to make the better choices in the foods they are purchasing and how they prepare it. We're also doing a lot on understanding a hunger cue versus being bored. And boredom, and what can you do with your child? Do you feel safe in your neighborhood? Can you let your child outside to play? Is there a safe playground? And those are some of the things we all approach on getting the balance of the physical activity, offering them excellent foods, encouraging them to make better choices in how they prepare it and in portions. So it's a one-on-one thing, you know, that's going to take time, but we have noticed that we had to change our approach to be more participant-centered and not be the professional telling you what to do, and that you need to take the ownership. So we assess and educate and follow up with them and reassess them. It's a little bit of a different strategy, but we've seen great improvement.
Thank
in what
you.
we're doing. Yeah, sure.
Speaking as a former child who wore Huskies for most of his life, important thing to do. And I see my own children day in and day out, and looking at, we all do this, you know, when I was a kid, you know, we go back to that kind of stuff. And it is much easier these days to make unhealthy choices. I begrudgingly will pay out for that water bottle more money than I can get for that Diet Pepsi if I really wanted to. So it's one of those things where I think that that's choices in education are going to be an important part of what we do going forward. We're out of time today, but I'd like to thank the panel for coming in today and helping us. If you have any additional questions, if you'd like to, we'd appreciate it if you fill out the survey. If anybody does want to contribute to Warm the Children, if you can leave the check with Jesse at the front door when you go out and drop off your name tag, we would appreciate that. And we are having one last shameless plug. Warm the Children is having their first fundraising event. That's this weekend on Saturday and Sunday, where we are presenting Kaleidoscope Dance Theater over at West Middle School at 3 o'clock and 6 o'clock, 2 shows daily. For that, and a part of those proceeds are going to be going to Warm the Children. So hopefully I can do something about that.
And how can people donate to Warm the Children if they don't have their checkbook with them?
You can come to the Citizen and drop it off. There are forms in the paper that we publish from now until February. And don't let the weather fool you. It's going to change. I looked back, and at this time last year, Buffalo had 6 feet of snow on it.
Yeah, right.
So wait a couple days, and we'll see. Although Christmas is supposed to be 6 feet of snow. Yeah.
Rob, I just wanted to take a second and thank the 3 ladies for the work they do. It's remarkable. We have so many barriers that we have to break down to educate children, and health is a huge one. Trying to learn with a toothache or being hungry is almost impossible. So thank you, ladies, for all that you do for the children. We couldn't do it without you. So thank you.